Assalamu alaikum viewers, welcome back to my YouTube channel, and today we will discuss the Epstein Barr virus. As you can see that the background is the blue, so it reminds us that it is also a double-stranded DNA and it causes the infection mononucleosis, that is kissing disease. As you can see, this couple is trying to kiss, so it spreads through the mouth secretions, so it is also called as the kissing disease. And this guy, you can see that it is pulling this from the back of the neck, so it causes the tender lymphadenopathy in the posterior cervical region. And as you can see that the T is written on it, which reminds us that it attacks the cytotoxic T cells, and his violent reaction, it shows that it causes the reactive lymphocytosis, which is also known as the Downy cells. And the stains on its clothes, it reminds us that the cells look like the downy shape and with oval or the folded in the nucleus. On the back of the cow, you can see that the spleen and the liver are shown. In this case, the T cells proliferate and causes the splenomegaly. Now here, this guy, you can see that this is wearing the white clothes. This guy shows that it also targets the B lymphocytes, specifically the white blood cells, the new host. And EBV जो है, it remains latent as it is sleeping, so it shows that it remains latent in the B cells. And it also develops the maculopapular rash, as this guy is holding the pencil and it is developing the rash. So it develops the maculopapular rash with the penicillin treatment. Along with amoxicillin and ampicillin, that does not cause the allergic reaction. And as this guy, you can see that there is some difficulty, or there is some sign that it has the pharyngitis. So this also causes the pharyngitis, and this pharyngitis is different from the streptococcus pharyngitis. Streptococcus pharyngitis जो है, it mostly occurs in the childhood, while ये वाला जो pharyngitis EBV cause करता है, this occurs in the late adulthood, and mostly it is asymptomatic in the children. And this, you can see that it is written must be 21. It shows कि जब ये B cells को टारगेट करता है, तो ये हमें रिमाइंड कराता है कि the EBV enveloped glycoprotein must bind with the CD21. CD21, it is a component of the complement component, that is CD3. So ये उसके थ्रू जो है B cells को infect कर देता है. So when the B cells are infected, there are increased risk for 3 types of the cancers. So this picture in the all, it represents weakened immune system. So weakened immune system जो है, उसकी वजह से हमारे पास Hodgkin lymphoma होगा, that is a type of the B cell lymphoma. This guy, you can see, it is pulling the crab, so it reminds us that it also causes the non-Hodgkin lymphoma, that is the Burkitt lymphoma, in which the translocation 814 is going. And this guy, through which the crab is pulling his nose, so it reminds that it is also a risk of the nasopharyngeal carcinoma in the Asians. And also this guy, you can see that this is immunocompromised cane is holding. So in immunocompromised patients or HIV patients, it causes the oral hairy leukoplakia, and it is not a precancerous lesion. Now here you can see that this is a medial David board, and इसके ऊपर हम जो भी थ्रो करते हैं, so हमारे पास एक spot पे जाता है. So the spot represents that monospot IgG test is done for it during the acute infection, and इसमें हमारे पास sheep antibodies secrete होती हैं. Okay, the last one, no contact dowsing. It reminds us that it must avoid contact sports due to the risk of the splenic rupture. So here ends the Epstein Barr virus. Like, subscribe and share with your friends. See you in the next video. Allah Hafiz.